Morning and welcome to our Ask the Expert for January. Today we have Dr. John Blakely, and he is a small animal vet surgeon. If you want to go ahead and introduce yourself and tell everyone about you, John, I'll hand it
Sure
over.
thing. Sure thing. So, my name is Jonathan Blakely. I am a small animal surgeon boarded with American College of Veterinary Surgeons. I work at a Blue Pearl Hospital in San Antonio, so it's a private institution. And today we're going to just kind of go over the small animal veterinary surgeon career, what it takes to become a small animal veterinary surgeon, as well as the responsibilities, rewards, as well as challenges of this career. Uh, Starting off, looking at the introduction to veterinary medicine, you'll see a lot of Texas A&M stuff. I am an Aggie. I went to undergrad and vet school at Texas A&M. For a long time, Texas A&M was the only vet school that is in Texas. However, Texas Tech has recently opened one, and they got a lot of good incentives as well for large animal vets. So if you're interested in large animal vets, Texas Tech is a pretty good school for that as well right now. But I'm an Aggie, so I'll always, support their school and promote them. Looking at an overview of veterinary medicine encompasses a wide range of things. And when you get out of vet school, there's many different pathways that you can go. We have an overall goal of course, animal healthcare, as aiming to prevent, diagnose, and treat diseases as well as injuries of these pets. And we also play a pretty vital role in ensuring the public health, as well as many zoonotic diseases that can be transmitted from animals to humans, such as anthrax, rabies, West Nile virus. All of those are things that can cross over, and we play a very important role in keeping that from getting into the human population. You'll find veterinarians in many places you don't initially think. There's a lot of veterinarians in the USDA, the CDC, government roles, as well as creating the formulas for the chicken feed and Tyson chicken. So there's many different places you can go. Of course, the most of us go into practice where we start treating patients. So with small animal surgeons, we are specialists. We have gone through extra training to gain that role. And we are crucial for performing surgical procedures on our pets, ensuring that they receive the proper medical attention that they need. We definitely enhance the quality of life for pets that was not there 50 years ago when we weren't as common. And we address some pretty serious health concerns. 50 years ago, again, small animal vets would have these cases come in that were very severe. And most of the times they would end up in euthanasia, or the primary vet would throw their hand at it. But quality of care and standard of care has definitely raised to where now it's referring to us to treat these kind of severe cases. There's a lot of career opportunities in veterinary surgery, not just doing cutting. There's a basically diverse career paths, including general practitioners that are doing regular things like spays, neuters. There's whole groups that are focused on that. And then where I am is more in the field of orthopedics, neurosurgery, and soft tissue surgery. There's also a lot of roles in academia and research. So teaching students, teaching them how to perform surgeries, as well as doing research in academic institutions is a big part of a lot of surgeons' careers. Some of the most famous veterinary surgeons are the ones that are in the academic institution, and doing the research is advancing our entire profession for all of us. There's also opportunities where I'm at, like in private clinics, animal hospitals, and as I said, research institutions. You can also see us in roles of even management. A lot of veterinary surgeons, especially in the corporations, advance that hierarchy and become a higher up manager essentially in those corporations. So the path to becoming a veterinary surgeon, it's a long one. You'll see Texas A&M up there again, Aggie here, to undergrad and vet school. You also see Mississippi State. That is where I did my surgical residency, so I stuck with the maroon. Educational requirements, you start off with your bachelor's degree, so undergrad for 4 years, and then you need to try to go for vet school. Vet school is very competitive. It requires a pretty high caseload of biology, chemistry, and animal science. And even more so these days outside of school in education. So doing volunteer work, working at a vet clinic, getting that hands-on experience is becoming more and more important to help you get into vet school. But once you get into vet school, then you're going to get out, graduate, you'll pass your tests, and then to become a surgeon, you're going to go ahead and do a rotating internship for an additional year. And I have plus or minus surgical internship. Sometimes you can get straight to a residency, but it's pretty uncommon these days. Most of the times you do need to go ahead and do a surgical internship, if not one, sometimes two. Also these days, since surgical residencies have become so highly competitive, some students are doing surgical residencies, and then they're doing a research position in an academic institution or a fellowship in a certain type of surgery to try to increase their resume to help them get that residency. But ultimately, we enter a match system that's very much like human medicine, where we put our name in the pool. Colleges put and institutions put their name in the pool, and then we are matched according to what the ranking system is of the institutions. But again, work experience, recommendation letters. So knowing people and knowing surgeons to give you good recommendation letters is pretty important, as well as publications. So getting published with a scientific journal has become very important in getting yourself a residency. Just to kind of give you an idea of how competitive it can be, up there in the top right, small animal surgical residencies of 2024. So just last year, there was 50 residencies offered nationwide, and there was a total of 254 applicants. So about 20% resulted up with a residency. So it's definitely not something you're necessarily going to get the first try. You got to keep going for it to ultimately get to that point. So the necessary skills and qualifications of a veterinary surgeon. So you got to possess strong analytical skills. You need to have extensive anatomical knowledge. While everything looks like the book, it doesn't. So when you look at the book and you see the pathways of how you're going to do this procedure, when you get into the actual patient, it's often very different. So you need to have that strong anatomical knowledge to decide what is what while you're in there, especially in cases of fractures or chronic injuries where everything is altered from the normal. You need to have strong attention to detail and manual dexterity. The other thing that I would say is you need to be kind of with manual dexterity, you need to be cool-headed and calm in stressful situations. If you get stressed out and your blood pressure raises, your hands are going to start to shake, and that can definitely cause some severe issues when you're trying to perform very delicate procedures. So you need to be cool-headed in those kind of situations as well. You also need to have pretty good communication skills. A lot of people tell me they want to be a vet because they like animals more than they like humans, and that's not our career. I mean, ultimately in veterinary medicine, outside of the OR, most of my time is talking with clients, going over what's going on with their patient, dealing with them financial issues that they may have, as well as making sure they understand what they need to do at home. A lot of success. I always tell people that I have an easy job of fixing it. They have the hard job of the post-op care and making sure that everything goes appropriate. So you need to be able to communicate with people well and talk to them well so that you can increase the outcome of your patient and make sure they do well. And it's also in the hospital setting, there's a lot of people, so you need to be able to communicate with your colleagues so that you don't miss what's going on with your patients. So licensure, certification. So after you finish your DVM at your college, you basically take the NAVLE here in North America. That's a pretty intense test. It goes over every animal that exists basically and all the different diseases that they can experience. Everything from cats and dogs all the way up to pigs, horses, zoo animals, all of that is on that test. So it's a pretty intense test. But once you pass that, then you can pass your state-specific legislator requirements. Here in Texas, it's a 50 question test. It's not too bad. It's mainly about the legality of what we're allowed to do as a veterinarian. And then once you're finishing up your residency to become an ACVS surgeon, you also have another test called boards that is pretty intense. And with that test, you're given two phases. Phase one is right after your second year of your residency. And that's tested mainly over anatomy, physiology, surgical specific knowledge, things like the immune system, the clotting system. You also need to know all the anesthetic options that you have in regards to medication. So there's a lot of pharmacology on that test. And then phase two, it seems like it's going to be easier because it's like specific cases, but that's actually much more difficult because you have to diagnose, give the appropriate treatment options, as well as be able to quote scientific literature. There's basically it's tested over the last 5 years of scientific journals. So it's two big tests, but once you pass that, you're boarded and you can call yourself an ACVS surgeon. Then there's also continuing education, so it never stops when it comes to education with veterinary medicine. In Texas, you're required to get 17 hours of continuing education every year. It renews on your birthday. And then this ongoing training basically helps ensure that you stay informed on the advancements in veterinary medicine and surgery. They're trying to avoid people getting stuck in their ways and doing things that are no longer considered the standard of care. So that's just trying to increase your knowledge as you grow as a veterinarian. And to maintain your diplomat status with ACVS, you also have to get continuing education. You essentially have to get 100 points every 5 years. And that is done through scientific meetings, continuing education. Getting published gives you some points, as well as training residents can give you points, or attending any surgical training laboratories. So there are a lot of labs that we get to go to that help us increase our surgical skills. And it also helps you keep your certification. You definitely want to keep that certification because if you don't get your 100 points in that 5 years, you have to take the test again, phase 1 and 2. So we work really hard to keep that going. So the daily responsibilities and duties of a veterinary surgeon. So mainly, the vast majority of our time is spent in the OR. We do a range of surgeries, especially in private practice. We get to do soft tissue procedures every day. There's cardiothoracic surgeries that we do, a lot of neurosurgery, lots of dachshunds here in Texas. And so we get to do a lot of back surgeries. You can see that dachshund down at the bottom that has a wheelchair that we can custom create for them. And then lots of orthopedic procedures. Up there on the top left is a total hip replacement that we do to help give them a healthy joint. You can see on the other side how bad that hip is, and now he's got a good hip on that right side. So we get to do all of that, and that's one of the joys of our career is being able to do all these different things every day. But you have to have a mastery of these techniques, and it's pretty essential. We know that the longer anesthesia time, the more complications you have. So being efficient and having effective treatment not only reduces your recovery time, but it also reduces your complications that you can see. So there is a lot of practice. We do cadaver labs where we make sure that our techniques are up to snuff. And again, there's laboratories that we go to help make sure that we're up to date in our training. We also do a lot of diagnostics. It's not just OR. So we do x-rays to help diagnose what's going on with the hips and the bones, ultrasounds to look into the abdomen, as well as muscle ultrasounds. We do a lot of muscle and orthopedic issues we can identify on an ultrasound, such as biceps tendinosynovitis and things like that. CT and MRI are becoming much more common in most facilities. I have both at my facility that we can do readily. CT, we're using more and more for these advanced masses and cancers to identify all the locations that it is, as well as for orthopedic cases. We're doing 3D reconstructions using CT to help make sure we're doing the best possible procedure that we can. And then MRI, we're using that regularly for back dogs that need neurosurgery as well as brain. We identify brain tumors, and I have gotten the opportunity to do some brain surgeries. And so those are all important diagnostics that we use pretty much every day, as well as lab tests that test for things like coccidioidomycosis is out there in West Texas and down here in South Texas, as well as other fungal disease. Those are all tested with the lab. This just provides us quick and accurate diagnosis, and it leads to a timely treatment and improved animal outcomes overall. So client communication and education, again, effectively communicating with pet owners is vital because it helps us make sure that they're doing what they need to do. It helps make sure that the patient does well overall and make sure that they're comfortable with what we're proposing. Sometimes we're not a cheap profession. There is a lot of expense in pet care these days. So making sure that they understand what we're offering to do and what it's going to cost them is very important. So again, client communication can't be stressed enough in this profession. I put a X-Fix up there as a picture. So that is an external fixator. It's basically fixing a radius fracture that's there. And as you can see, the construct is actually outside of the bone. So those pins are going into the bone to hold it in place. And then there's a construct that is holding those pins in place that is outside of the bone. And the reason I put it on this slide is because we can put that construct on there, but if you don't care for it, It can get infected. It can have a lot of complications. So again, making sure that the owner understands what they have to do at home to make sure that goes well is very important. Again, with communication, collaboration with your vet staff. We have a large hospital here in San Antonio. There is a large front staff that is dealing with the clients and making sure that they're financially stable and doing what we need to do. There's the ICU staff that is taking care of my patients and keeping an eye on their vitals and making sure that they're recovering appropriately from anesthesia. And it's important that they're able to communicate with me effectively, and so that I know what's going on with my patient and treating it as I need to do. As well as there's the OR staff. So you can see Brent here with Dr. Israel, one of my colleagues. They're doing a scope. He is helping out in the procedure. And so being able to communicate with him at that time that what he needs to do, as well as at the front of the patient that you can't see, is an anesthesia tech that is running the anesthesia for that patient, taking care of the blood pressures, the ISO levels, everything they need to do to make sure that patient is stable under anesthesia. And they're constantly communicating with us at the back of the patient to make sure we know what's going on. So teamwork enhances surgical efficiency, patient care, and it fosters a supportive working environment within the clinic. Emergency care. So that's something that sometimes we don't think about, but as surgeons, we actually do a lot of emergency cares. A lot of cases that are surgical cases come in critical situations. We're on the front lines of a lot of these emergency cases. Attacked by dogs that have open chest wounds. We need to be able to assess them, figure out how to get them stable and how to get them into the OR. It requires that quick assessment and quick decision making. You need to be able to make a decision and run with it. The skills in trauma management and critical care are vital. We do have critical care doctors at my hospital, which is extremely helpful. I appreciate them every day, but they're not always there, and we'll still have to make decisions when they're not available. So being able to assess a patient and take care of it, get it ready for the OR is all part of my career. On the side here, I have a picture of a humerus fracture. This was a gunshot wound. So this is the bullet that is right here. That's the bullet right there. And it went through the humerus, shattering that humerus, and actually went through part of the dog's neck as well. And so what that does is basically when that dog came in, it was in shock. So we needed to stabilize this patient, make sure that it is safe for anesthesia. And then we took it to surgery once we got it there. So once we get past the emergency care, we can take it into the OR. And we did an X-fix as well as cerclage wire to get those bone pieces together, a couple positional screws, and then again another external fixator to get that bone. And then there's going to be a rod that's right here to keep it in place. The bullet we were able to remove, so that's good. So the challenges and rewards in veterinary surgery, there's a lot of rewards, a lot of challenges as well. So up here in the top, this is the first fracture I repaired as an intern. I was pretty excited at the time. And then here is a large spleen I removed as an intern. So these are all the fun things we get to do and the rewards of seeing these cool cases. But there's also challenges. So this middle picture is a case that I'm actually dealing with right now that is a chronic fracture. It was a rescue organization that got this poor dog that had came this way. And they don't know what happened to it, but it's definitely been that way for a while. And so then trying to fix these multiple pelvic fractures, and multiple femur fractures on both sides can be a real challenge. And also just dealing with this is a rescue, they're usually pretty good, but sometimes the clients having to put out money for this kind of situation can be a big challenge as well. The most interesting aspects of the job, I would say that it's the diverse cases. We see so many different things every day. Every day you're going into work, you're not sure exactly what you're going to be doing that day. We do have appointments, so I know it's on the schedule, but at the same time, emergencies are constantly coming in and we're changing up our order of surgeries depending on what those cases need. But we see everything from, porcupines, attacks, and those are fun because they're very rewarding, taking all those quills out. Again, fractures, soft tissue cases, every day is a little bit different. And also as a specialist, we get to see the very abnormal cases, the things that are not very common are more common to us because we're getting them transferred from all over the state of Texas to us. And so we get to see these rare conditions and diagnose them and then treat them. And the ability to make a significant impact on these pets' lives is a huge reward, as well as to the owner. These pets are really loved and really cared for by these owners. And so being able to improve the owner's life as well by keeping their pet healthy and good is a huge reward in this role. Some common challenges. So it is a stressful environment at times. You're dealing with a lot of different things, including really complicated cases. You have the issues of finances at times, and those financial decisions can lead to euthanasia decisions, which can be very hard to see a case that you think you can heal, and then ultimately it does not, or a case that you want to fix, but they don't have the finances for you to do so, and so then you have to euthanize, and that can be very stressful and hard emotionally. There's also the things such as like anesthetic death. Sometimes the most healthy patient has a bad reaction to anesthesia and results in death, and that can be a very hard conversation for the owner as well as just for yourself, having that happen. And just the reality is sometimes of animal suffering. And moreover, it's definitely long hours. There's cases that go much longer than you expect them to go. You think it's going to be a hour procedure and it ends up being 4 or 5 hours, goes into the night. We're often on call, so that I get called in the middle of the night, 2 a.m., about a case that has a GDV where the stomach is flipped, and we need to go in and surgically fix that now, because if you wait on that, the patient will die. So you can be on call at some facilities. Not every facility has on call, but ours does. And so, as well as high pressure situations, let's say, being in a situation where a small slip of the finger can lead to a really bad complication. So that can be very stressful at times, and burnout is definitely an issue in veterinary medicine. And so you need to be able to manage that stress appropriately to overall do well. But as I said, there's a lot of emotional rewards watching these pets get better. As a surgeon, we always say that we fix things. So we don't just treat them, we make them better and make them normal. And that's always our goal. And getting to see those animals recover and the joy of that, as well as the joy to the owners that we get to see as their pet comes out doing really well, is very rewarding. There's definitely some financial rewards as a veterinary surgeon. It is competitive salaries. We're definitely in demand. There's a lot of places that are looking for veterinary surgeons, and the pay scale reflects that, because there's specialized skills, the work it takes to become a veterinary surgeon. We are in high demand, and as the quality of care rises for pets, so does the amount of surgeons that are needed. The other thing is that we have a big impact on animal welfare and community. So veterinary surgeons, again, we play a crucial role in enhancing that welfare through medical care and the public education of responsible pet ownership. And our contributions help animal suffering and improve the overall community standards and create a positive impact. So career, again, the job market, we're definitely in demand. Okay, so there's a rising call for more surgeons, and there's basically not a hard place. Not It's not hard to get a job as a veterinary surgeon once you've gotten to this point. Most places are trying to get you there and trying to be the more competitive option for you compared to you trying to promote yourself. Job openings are still projected to grow. There's more and more pet owners. There's 86.9 million homes in America with pets, and comparatively, there's only 2,383 ACVS diplomats. So there's not a lot of us in America to treat all these pets. And so we are getting about 70 new diplomats every year, but that's still a small amount. And so again, high demand for this profession. Pay scale is pretty good. So when you get out of vet school and you're starting off, if you're just a primary vet, the starting salary is usually around $70,000 to $100,000, depending on your experience and your location. If you're in New York, you're going to get more money compared to rural Texas. But ultimately, that's kind of where you start off, which is pretty good. But at the same time, you're getting out of vet school with some student debt, and so a lot of us are specializing to get a little bit higher pay scale. And as a surgical specialist, the starting salary is usually somewhere between about 200 to 300,000. And you also get commission on cases. So you usually get about 20% commission of those cases as well. So depending on how much surgery you do, you can make significantly more money. Factors that can influence your income, again, location. New York City, definitely, in California, definitely have more money and their pay scale is a little bit higher, but so is the cost of living. So that's the thing to consider. But type of practice, so what you're doing can help you have more income. So if you're doing total hip replacements, if you're doing advanced joint replacements or arthroscopy where you're scoping that, that can be a higher pay because you're doing more advanced procedures. Specialty training again as a surgeon, and then years of experience. So experience is a way to make more money too, because as you get more experience, you get faster in these procedures and you can do more of them per day. And so that is all kind of a factor into that. Private practice surgeons, we do make higher money compared to shelters or academic institutions. The trade-off there is if you're interested in something like research and advancing our profession with research, academic institutions typically have more funding for that. And so that is a consideration of going that route in academia if you are more interested in that research side of it. Also, teaching students is a pretty big reward. I definitely enjoyed teaching students as a resident, and that's something you can only really do as an academic institution. So future innovations, we're advancing just like human medicine is advancing. We're doing more and more complicated joint procedures. Again, total hips, total elbow replacements are becoming more frequent, as well as total knee replacements. They're still pretty rare, but we're seeing more and more places that are doing those kind of procedures. We do have some places that are doing telemedicine, at least as consults. Ultimately, for a surgeon, they always got to get into the OR. As well as interventional radiology. So imaging techniques. Down here is there you go. So down here is a fluoro where we're doing real-time radiography, and that is allowing me intraoperatively while I'm doing the procedure to make sure that that screw is right in that sacrum where it needs to be. So we do have those techniques here at my facility, but other facilities also have interventional radiology for doing catheters, where they're placing catheters up the femoral artery up into the heart and the liver. So those are all things that are available and possible these days. Robotic surgeries, not super yet in animal medicine, but it is having some hints of coming this way. It's definitely becoming more common in human medicine, but in veterinary medicine, it's still taking its time. But I do expect that with the advances of artificial intelligence, we will see a little bit more of that come this direction. Artificial intelligence is also being seen with radiology. So now there's AI readouts of radiographs and CTs. So that is, again, advancements that we're seeing. So then I thought I'd just finish off with some cases that I see, some things that I've seen recently that are interesting cases. So here is a tibial fracture. So this dog basically had a fracture of its tibia that was pretty comminuted. We call that a midshaft diaphyseal comminuted fracture right here. Looking on this side, you can see that the fibula is also fractured, but we don't worry about that. It's low weight bearing. And actually had a fibular fracture on this side too. But again, since we don't have to worry about that, we just focus on the tibia. And so for this dog, we did a plate fixation. And so we put a metal plate on there with a lot of screws, but it came back together very nicely. You have a positional screw here to basically get that small piece that was fragmented back into place, and then have that plate to hold it all together. So this is a large wound case that we had. This dog had been rolled essentially by a car, and it tore off all the skin of its back. And you can see when it comes in, it looks like a pretty nasty wound. All this skin was very dirty, had gravel in it, everything. This is actually after we cleaned it out a little bit. But here's the back leg here, and then the front leg. So you can see it's a large wound on this dog. And so we started off by cleaning up the wound really well, getting into a healthy wound bed. And then for this dog, we elected to do punch grafts. So we took punches of skin from other places that had skin on this dog and then placed it into this wound bed. And the idea behind that is when we get all these punches in, that the epithelium from these grafts will grow outwards and allow us to cover epithelium over that entire area. It'll always look scarred. It won't look normal, but it will have healthy, at least, epithelium covering the wound. So here's a little bit more advancement of that, where you can see those grafts. And then here you can see the islands starting to form where the epithelium is advancing outwards from this area. And then here more so, you can see those islands expanding and starting to grow together. And then unfortunately, this is the last picture I have because the guy lived down in the valley and didn't want to come back up anymore because he said it was healed and doing great. But this is the last picture we have. You can see again, it doesn't look normal and it will fill in more. That epithelium will start to kind of even out where it doesn't look as bumpy. But overall, this dog did really well. And from what I understand, did great long term. Another option that we do have is for large wounds is tilapia skin. So this is actually fish scales that have been harvested. And this was a dog that had been set on fire. So it had burns over the vast majority of its body. And we use this skin to cover those wounds so that the wounds can heal appropriately. And it's a pretty cool technique that we can do. The downside is that tilapia skin is not cheap. And so ultimately with that, we actually had this donated by a local hospital for us so that we could use that. So here's a radius fracture. This is pretty common in smaller dogs. They jump down and their bones are so thin that they just break off the ends of their radius. This was an Italian greyhound that broke both of his front legs by jumping down. And we typically fix these with plates. So here is a plate fixation on that left side and then the right side, and then just an orthogonal view of that left side to show you how that radius got put together by that plate. So again, the ulna is much like the fibula, but it's not weight bearing, so we don't worry about fixing it. All the weight's coming through that radius, so that's our focus in surgery. So brachycephalic syndrome, that's your bulldogs, your French bulldogs, those dogs that sound like they can barely breathe. Basically, they're due to a lot of extra tissue in the face as well as in the mouth. And so for these procedures, we go in first in the mouth and we actually look at their soft palate that can be very long and we'll shorten that palate. And then the other thing we look at is their nose. So their nares are often very very narrow with limited amount of airflow that's able to come through that nose. And so what we do is we cut a wedge out of that nose to help open it up so that there's more airflow. And through physics, we know that a small increase in diameter has a 4 times increase in airflow. So even that small amount of change actually drastically improves the amount of air that that dog is able to get through. And then humeral condylar fracture here. So this is a young puppy. And so when you're looking at this, this is a growth plate. That's a growth plate. This is a growth plate. So this is just a dog trying to grow. But over here, you can see that he jumped down and his radius came up and put a lot of pressure on this lateral condyle of the humerus and fractured it off. And so for this, we typically do a screw and pin fixation. And so we went in surgically, and I actually did use fluoro on this, so real-time radiography to make sure that we got that fragment right where we needed it to be. And then we placed a pin and screw, so a pin coming up to basically put that isthmus back to the humerus, and then a screw to connect those two condyles together. This dog is still healing, but I do expect him to do very well because that came together very nicely. And the aid of fluoroscopy definitely helped in making sure that it was right where it needed to be with that fixation. So intussusception. So sometimes dogs will have a GI motility issue where the intestines actually start to eat itself. Essentially, they wrap over another portion of the intestines and then start to digest that portion of intestines and can cause severe complications. And usually we can go in and either cut out that small little section or we can even take it apart and tack it so that it doesn't do that again. But this dog had a severe GI motility issue where when we were doing one part, so we'd already had an intussusception over here that we fixed and we're tacking, and it was intussuscepting in a new location. And so we had to do a large enteroplication where we suture all of the bowel together. So here's us suturing that bowel. And then here's when we were done. We basically had to do through the entire intestines, tack it all together so that it wouldn't do that in the future. And then as a last case, this is a chronic femur that basically the dog had a fracture when it was a puppy before it was even adopted by the owner. And when it healed poorly. And so you can see a normal femur on this side, and then this deformed femur from this fracture on this side. So there's angulation issues as well as joint connection issues here due to that fracture. And that dog was unable to use that leg at all due to this fracture. And so we did a CT and 3D reconstruction to get these pictures here. And then using those 3D reconstruction, we actually made a model where we could see where the angulation was and what the cuts that we needed to do to make it back to where it needed to be. And so here's our proposed cut across the femur, and then a wedge of bone that we're going to take out here. And we were able to use that print 3D printed guides. So I had actual guides for cutting that I used in surgery that fit this bone exactly. And then using those guides made my cut. And then I had a guide that I put on there that did the reduction for me. And so it makes it easier and it's really cool. And it also speeds up the anesthesia time. And using those guides, my end results here. So that was our proposed fixation of the femur. And then you can see where we got it. So pretty nice. Have a DFO plate on there. So distal femoral osteotomy plate here with 3 screws and 4 screws above. And then the other view, again, we have our proposed correction here, as well as what we ended up with. So that went really well. And it's a really cool part of what we're able to do now with the 3D printing guides to help us make sure that we do exactly what we need to do. So as a summary, being a veterinary surgeon, it's hard work for sure, lots of long hours, but it is a lot of fun and it's very rewarding. And I will definitely say we have the best patients. So with that, I can take any questions that there are and go from there.
All right. First of all, quite a few of our students are in vet tech programs through their high
Mhm.
school. Do you have vet techs? Do y'all utilize them in surgery or?
Absolutely. No, we definitely have technicians that are OR technicians. And so they are utilized both in a anesthetic role. So they're the ones that are running our anesthesia for us. And then when we need them, because we do have residents and we have interns, so a lot of times they scrub in with us for the OR. But a lot of facilities don't have that. And what they do is have a technician that scrubs in with them and helps them. And then the vet techs are also vital in our ICU. So all of our patients go out to the ICU after surgery, and they're being cared for by veterinary technicians.
If they would wanted to go into the OR, is that additional training? Are you?
Um, it's usually hands-on training, so it's not necessarily a school training. But if they're interested in that, we're always happy to get them to scrub in, even if they're not the only scrubber. We get them in there so they kind of get an experience of what that needs to be like and help them teach them. So most places that need that, they're happy to teach you what you need to do so that you can help them because they're vital for me too. I can't do a lot of these procedures without an extra hand to hold where I need it to be. And so having those technicians that can know, especially the ones that are knowing what they're doing because they've had that training or that, at least that experience, are super helpful in my career.
In addition with the anesthesia techs,
Mhm.
do they need the same requirements as for human health or?
So they don't have, I think, like, I guess, repeat that, ask that question a different way. I'm not sure what
Example,
you
your
mean.
anesthesiologist that they use in human health, do you need the same requirements for those who do it for the animal health?
So we do have boarded anesthesiologists in veterinary medicine, but they're even in higher demand than surgeons. There's not very many of them. And so we have one in the Blue Pearl system that comes down and trains our technicians. And so she's up in Oklahoma, but she comes down pretty regularly and goes over what to do for our veterinary technicians and teaches them. But there's not necessarily more like qualifications for them. They are licensed veterinary technicians, so that is something that you can do to further your kind of career as a veterinary technician is become an LVT. And so they are licensed veterinary technicians, but it's mainly us training them hands-on of what they need to do and then having the anesthesiologist come down as well.
And then, most of our students are in a pathway and working towards, some will go that vet tech route. If they want to go veterinarian, do you recommend
Mhm.
doing like the AS in animal in science or doing an animal science associate's degree, or do you think the vet tech program would give them that stronger basis and?
Yeah, I think animal science is a great way to go. I mean, they're going to need that bachelor's for sure. I was biomedical science is what I did at A&M, but there was a lot of fellow veterinarians in my class that did do animal science. In fact, I'd say probably over 50% were animal science in veterinary school. But being a veterinary technician, again, I think is a big part of it too. I was a vet tech since I was 16. As soon as I turned 16, I got a job and worked as a vet tech so that I had that experience. And I think that helped me get into vet school. So they want to know that you can work in that environment and know what that environment truly entails.
Right. And then Tell us about your most memorable case.
Man, I've had a lot of crazy cases. Some regards are the ones that I remember because they were so challenging. I had one case that I am occasionally still dealing with that had a was attacked by a dog, and basically the entire front of his chest or her chest was torn and destroyed. And so there was a large gaping wound there, and we had to do multiple surgeries to try to get that together. And then there was infection concerns and infection issues that we've dealt with as well. So sometimes you remember the challenging ones for that reason. But also we get to do really cool cases. I've done heart surgeries where we are fixing patent ductus arteriosus of the heart of puppies. And so there's small, tiny little vessels. And one dog I had that I remember, I'll always remember because he had another abnormality of his arteries when he developed that we had to adjust in time in surgery to make sure that we treated appropriately. And then the cool cases, like things like zoo animals. I've done surgery on a monkey, I've done surgery on a tiger, a penguin. And so we get to do those kind of different surgeries in our profession because the zoo vets are not typically doing that. When they have a fracture or an issue, they're going to send it over to a surgeon.
So did the penguin come from SeaWorld?
No, it was actually a zoo up in Dallas, I think, or something
Okay,
like
all
that. Yeah.
right. Cool. All right. Those are all the questions we have.
Okay.
If anyone has any further questions or something pops up, I can definitely connect you with Dr. Blakely for any further questions that you have. But thank you so much for meeting with us today and sharing your experiences with the kids. This is a great career, and we do have quite a few kids in the vets tech field, and as well as some of our animal science programs. So, this is another route that you can go if that's the way you're interested in. Uh,
Absolutely.
Thank you so much, John, and we appreciate it.
Thank you. You have a good day.
Thanks, you too.